Welcome to my channel, Health by Heather Hirsch. If you don't know me, my name is Dr. Heather Hirsch. I am very passionate about midlife women's health, and I am the lead physician at the Menopause and Midlife Clinic at the Brigham and Women's Hospital in Boston, Massachusetts. And I have really started this channel to help increase knowledge and education advocacy in all areas that I can. So in today's video, I wanted to go over how to tell if you are in menopause, because it's not as easy as it seems. You know, by the textbook, many of us know that menopause means 12 months of no periods, but for many of us, that just doesn't work. Perhaps we've had a hysterectomy and we no longer have bleeding. Perhaps we have an intrauterine device and so we can't go by our bleeding patterns. Or perhaps we just can't remember and things have gotten very confusing. That's really common also. Midlife is a time where women are really busy. They may have young children at home. They may have children that are going off to college. They may be taking care of parents. They may be, at the peak of their careers. And so it is a really, really busy time. So not everyone follows the textbook. In fact, most women do not follow the textbook. So I want to go over how do I as a physician help you determine if what you are experiencing is in fact menopause. So this is a really, really great place to start. If you're new to this channel, welcome. I really am excited to kind of dig into this big topic. How do I know if I'm in menopause? So one of the most important things is to start tracking your symptoms. And the earlier you do this, the better. I have many people ask me, when is the right time to start tracking? You could start tracking in your 30s, in your 40s. It doesn't matter. The more you know about your body, the better. But I really think tracking both periods and any type of symptoms that you might have is really helpful. Because then when you go to the doctor to talk about your symptoms, you're not spending so much time playing detective and sort of thinking in your mind, when was my last period? When did I have those symptoms? How long did they last? You already kind of have a book or a journal where you've written everything down and you've been really keeping really close track. So start tracking your symptoms now if you haven't been doing it. So what types of things should you track? Well, the obvious things, definitely your periods. It's really easy to forget when our last period was if we will say, oh, I'll write it down or I'll stick it in my app, and then we don't. So it's really important to start tracking your periods and also track your symptoms. Notice if you're having new hot flashes. Notice if you're having trouble sleeping. Notice if your mood symptoms are changing. Very commonly, women will have increasing anxiety above baseline. Maybe it's irritability, anger, hostility, all of those things. Many women can sometimes feel more emotional or tearful, or they'll say, I was never really emotional, and all of a sudden I can cry at the drop of a hat. So write all those things down. Also, if you've noticed any painful intercourse, if you've noticed any type of dizziness, a lot of these things can be symptoms of menopause. And so keeping good track is the best place to start. So when my patients come to see me, I ask, when was your last period and what are your symptoms? Because there's 3 things that I use when I'm kind of calculating if you are in fact menopausal. The first, if it's possible for you, is not having periods in 12 months. And again, I mentioned this might not work for you if you've had a hysterectomy or you no longer bleed, meaning you have an IUD, or maybe you've had a uterine artery embolization, so you no longer bleed. Or maybe you've had an ablation because you've had heavy periods in the past. So you cannot use number 1 if you don't have any periods anymore. And so number 1 is good if you're still having periods, which is, when was your last period? So yes, menopause is 12 months of no bleeding. If you've gone 12 months and then you had a period after that, we actually consider that postmenopausal bleeding. So you really want to keep good track. And postmenopausal bleeding should definitely be investigated. So you do really kind of want to know if you've gone a whole 12 months without a period. So number 1, you might either say to me, yes, I know exactly when it was, or you might say, I don't get my periods anymore. I haven't had them in a few years or maybe a decade. And so I have no idea. So you cannot use your menstrual period. Number 2, the second thing I look at is your symptoms. So classic symptoms can help me, especially if I need to be a little bit more of a detective, if you don't have a uterus and you don't bleed anymore, I really need to know your symptoms. When did they really start to get worse? When did you notice that these things happened consistently? When did you notice they were affecting your quality of life? That really kind of helps me hone on, is this menopause? Or could it be other things? And what are the other things that it could be? Well, most commonly is perimenopause, and perimenopause is the time leading up to menopause. It can last anywhere from 1 to 10 years. It's usually not that long, but it can last a span of really long time. So you really kind of want to keep track, another good reason, of your symptoms. Now, even if you tell me, well, Dr. Hirsch, I have, my last period was 3 months ago, and the one before that was 3 months ago, and the one before that was 3 months ago. Well, I know you're probably still perimenopausal, but you tracking your symptoms is going to be really helpful for me to figure that out. Typically, if you're still perimenopausal, you might see some waxing and waning of your symptoms. And if I see that in conjunction with what you're telling me, your periods, then I can sort of think this is probably perimenopause. So number 2, the second thing I really look for is, what kind of symptoms are you having? We all know classic symptoms, of course, again, as I mentioned, are the hot flashes, maybe the trouble sleeping, maybe mood changes and painful intercourse. But there are other things that you might notice. For example, that dizziness feeling, which we call vertigo. You might notice changing in your voice. You might notice hair loss, changing or slowing metabolism. There's many common symptoms. And so there is not one thing that doesn't necessarily fit. So that's why I think tracking is so helpful and so important when you're having a frank conversation with your doctor. All right. Number 3 on the list is your lab work. So this is a really important point, is that you actually don't need a ton of lab work. You really need a few labs only for me to determine, because the most important thing is going to be the history that you give me. So it's going to be number 1, your period history. Number 2, those symptoms. And then again, I use your lab work sort of to kind of round everything together. Now, in my course, The Complete Guide to Menopause, which I will link in the description box below, is really, really wonderful. And I have a whole lesson on interpreting your labs. And so I'm going to get into it quickly. But if you want more, detail, if you want to learn more, the course is really awesome for this. But essentially, when I'm checking labs, I'm really just checking a few labs. And the most important to me is probably called your follicle stimulating hormone level, or your FSH for short. When you're menopausal, your FSH is going to go up and up and up and up. Your FSH is the hormone that keeps that tells your ovaries to pop out an egg, and so that you can get pregnant. And your FSH gets really mad when you're menopausal, because you're not making any eggs anymore. You're not ovulating. So it keeps screaming from the rooftops, give me that egg. Let me try and get pregnant. And so your FSH is very high if you're menopausal, typically above 35. Very commonly, I see it in the 40s, all the way up to about 100, 110. It doesn't mean that if you're 110, it's more severe than if you have an FSH of 40. It just means that you're menopausal, and that is the lab value that's just the number your body is making. And your estradiol, the main estrogen, is low, right? The main source of estrogen in your body comes from your ovaries. And at menopause, a year after no periods, your ovaries pretty much go to sleep, and you really don't make any estrogen anymore. And so the estradiol is going to be low, and your FSH is going to be high. And I use those 2 labs to help me determine, if this is menopause. Now, what happens if you're in perimenopause? So great question. It kind of means your labs can be all over the place. And it really depends on where I get you on that snapshot that day that we get your blood work. Very commonly, I'll see an FSH around here, I'll see an estrogen level around here, and sometimes that's why it's helpful, again, to continue to track, to continue to monitor your symptoms, and to, maybe get your lab work more than once, because more points on a graph are going to help me know, is your FSH, going up and staying up, or is your FSH just kind of middle of the road? So your labs really help me in conjunction with your last menstrual period and your symptoms to determine where you are. Now, I do check a couple other things. I always check a TSH level and make sure you're not having hot flashes from hyper or hypothyroidism. I also will sometimes check an A1C, make sure you don't have prediabetes, because sometimes also with the onset of diabetes, you can have hot flashes and other symptoms that can mimic menopause. So you want to make sure you're not missing that. I like to also check just a vitamin D, make sure if mood is low, it's not because you have low vitamin D, which is really easy to, adjust to get those levels good if you take over the counter vitamin D, 1,000 units or 2,000 units a day. So I definitely will check some other lab work as well. And if you are coming to see me and you are thinking about starting a treatment, be it hormone replacement therapy or non-hormone replacement options, I'll also sometimes make sure that the rest of your blood work is updated. That means if your physician hasn't checked your cholesterol lately, I'll check that as well. If your physician has not checked just your electrolyte panel, I might check that as well, and your kidney function and your liver function, just to make sure those things are all good. If you've had those tests in the last year or so, I do not need to repeat them. They do not tell me anything about your system right now, and they do not tell me anything about you being menopausal. Now, I do sometimes check testosterone. I will check testosterone typically when my patients tell me that their libido is low and this is problematic. Testosterone is naturally going to go down at menopause. Again, that's pretty normal to see a low testosterone post-menopausally. But that number can sometimes help us decide with your health goals and your priorities if we are going to consider some type of testosterone replacement. And, we'll do other videos on that. And again, I talk a lot about testosterone replacement in my course. So again, check that out if you're interested in a deeper dive into some of these hormones and really what they mean and what your physician, could or could not do and talk to you about, because again, not one size fits all. So those are the things that I check and I look for when I am deciphering if you are menopausal, if you are perimenopausal, if it's a thyroid condition. Sometimes other autoimmune conditions can certainly either mimic menopause or make perimenopause or menopause worse. So it's not so easy, right? Just to know, am I menopausal is actually somewhat difficult. Most women do not follow the textbook. So if I can leave you with anything, it's definitely start tracking. I think, going to the store and getting a brand new journal for you is a great place to start. And that way, when you open it up, you can see everything at once. If you really prefer your phone, go ahead and do it all in an app. You can do that as well. But definitely start tracking so that when you do go have a conversation with your doctor, you are really prepared, knowing how long this has been going on, when your last period was, and what your top symptoms are. I also have a wonderful ebook on this topic. I will also link that down below, and it is a ebook on how to talk to your doctor about menopause. Again, it teaches you to really track these things, as well as just how to bring up that conversation and what sort of labs are going to be really important, so you don't have to write them all down or memorize them. You can have that right at your fingertips. So that is just a real quick overview in the Cliff Notes version of how to tell if you are in menopause. All right, I hope you guys enjoyed this video. If you have more questions or comments, link them down below. I will look through those and answer as many as I can. And if you liked this video, please subscribe and also hit that bell notification so that you don't miss a video whenever it comes out. I forgot to say that at the beginning, so if you're still here, please subscribe. Thank you so much for watching this video, and I'll check in with you guys again soon. Bye-bye.